Good afternoon, everybody. Welcome to the City of Toronto COVID-19 media briefing for Monday, June 15th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Brad, thank you and good afternoon. The priority of the city's long-term care homes has always been and remains the health and safety of the residents, the families, and the well-being of our staff. The long-term care sector has been hit hard, as we all know, by the COVID-19 pandemic, and for all those who lost loved ones, I extend my deepest condolences, and I'm sure I speak on behalf of all the members of City Council and all the people of Toronto in extending those condolences. It is for this reason that I asked staff in April to write a report that outlines not just what was done when COVID-19 became an obvious threat to seniors living in long-term care residences, but what we can do moving forward using new and emerging information, working in close partnership with Toronto Public Health, our hospital, and government partners. It was not meant to be the full, complete, and transparent and independent review the province must undertake on the entire long-term care sector, as they said they're going to do, but rather, I wanted to see us put down on paper what we learned in respect of our own long-term care residences, so that in the event of another wave, for example, we can have the benefit of those lessons from the first minute. I'm releasing that report publicly today in the spirit of transparency, and so that people have access to the same information that we have, and so that they understand the facts we have before us when we make decisions going forward. The City took early action to ensure a safe and secure environment to protect those in our 10 long-term care residences. The City actually owns and operates 10 long-term care residences, with the rest being operated by nonprofit organizations or in the private sector. First is prevention, an attempt to stop the virus from entering our homes. We introduced enhanced active screening early, including taking and recording temperatures of all staff entering a city-owned home. Masking protocols were enforced, and all non-essential visits were suspended. Enhanced infection, prevention, and control (IPAC) practices and procedures, including staff education, high-touch cleaning, and disinfection, were all done to help prevent the spread of COVID-19. But we know this virus has been extremely difficult to contain, so mitigation efforts were enacted, including active surveillance and precautions, including isolation, physical distancing, tray rather than dining room service during mealtime, and use of PPE, mask, isolation gown, gloves, and eye protection when caring for residents, as well as enhanced testing of both residents and staff members. These outbreak precautions are continuing in the city-owned long-term care residences, and we continue to see a reduction in COVID-19 cases in those residences. I asked staff to look ahead and advise us of changes that should be incorporated as part of future operations and in the event of future outbreaks, so that we could be better prepared. Some changes will be welcome and easily understood, while others may be more challenging for residents or for families, volunteers, or staff members. The new normal in city long-term care homes will include extra health and safety measures based on guidance from Toronto Public Health, from the Ministry of Health, and from Ontario Health. So, for example, we'll be maintaining screening of staff, essential visitors, and residents. We will be continuing to ensure physical distancing throughout these long-term care residences. We'll be maintaining infection prevention and control leading practices, resuming communal dining for residents while at the same time maintaining physical distance. We will be resuming resident programs, but with a maximum of 5 residents per group. We'll be resuming medical and other service appointments while continuing to focus on virtual consultations, which can be done online, as we're doing so much nowadays, where those are appropriate. And we'll be admitting returning residents and new residents that test negative 24 hours prior to admission, and they will then be isolated for 14 days. As part of our planning for this new reality in city long-term care residences, staff made 16 recommendations based on experience and learning from sustained outbreaks in some homes and the homes where there were no resident outbreaks. The City does not regulate or license long-term care homes. That is the responsibility of the province through the Ministry of Long-Term Care. And all operators, whether municipal, private, or nonprofit, receive the same funding, charge the same accommodation rates, and must adhere to the same compliance and regulatory standards through the Long-Term Care Homes Act. The regulation and licensing piece is important, as funding needs to be attached and sustained going forward. The city's report estimates an annual requirement of more than $14 million to make these changes I've been talking about for our 10 city-owned long-term care residences alone, in which some 2,600 residents reside. This report is now online at the city's website. I am very encouraged by the thoughtfulness and completeness of this report and the obvious care that our staff have for the residents, for their families, and for their fellow staff members. Seniors, as we know, were particularly devastated by COVID-19. Some of the news we've seen coming from private homes not run by the city, that news was horrific. Change across the sector is needed, and the city will gladly participate in a review as promised by the province. The report to me by our staff should give us assurance that city-run homes, while some tragically saw deaths because of COVID-19, made great efforts to contain outbreaks. Having said that, much more must be done, and this report sets out a solid preliminary list of those actions. We will do everything we can as a city government to protect seniors in our long-term care residences, to make sure that the entire provincial system is improved in the wake of COVID-19. That will have our full cooperation as well. And I want to say thank you to the staff members who served during this time, and of course the pandemic is not over yet, but I want to say thank you to the staff members that served and to those who provided leadership, including the writing of this report, which met my expectations as something we could have in hand relatively early on before the full-scale provincial review has even begun. We are also working on Toronto's economic restart and recovery. Successfully helping restaurants and bars restart and thrive is a key aspect of our recovery. This was especially brought home to me this weekend when I visited shops and restaurants on the Danforth and heard of their struggles to stay alive, even with something like the extra patios that I'm going to speak about briefly today. We must protect jobs, bring vibrancy back to our streets, and help create enjoyable experiences for our residents and eventually for visitors coming from out of town. We are working to help restaurants and bars maximize patios so they can hit the ground running when Stage 2 begins. Cities around the world have embraced similar approaches to encourage more patio and cafe space. At my direct request, city staff developed Cafe TO to help streamline the patio approval and expansion process. Next week, the Executive Committee will vote on the Cafe TO staff report, which I'm sure will be approved, but once it is approved and not before, it will then allow us to cut red tape and provide the necessary approvals to usher in what I believe will be the largest expansion of patio space in the city's history. It is one more example of the unprecedented action we have taken in the face of this unprecedented virus. Currently, restaurants and bars are not allowed to open for dining service, but they will be soon. And given the ongoing threat of virus spread and the need to keep customers and employees safe, we need to be flexible and ready to support them so that we're in lockstep in creating safe space that business operators have which they need in order to prepare to be open without a lot of red tape. This proposed program, developed in partnership with city officials, business associations, and the restaurant industry, is a measured, common sense, and quick start approach that encourages a revival of our local economy, protects and supports our business community, and maintains safety and public health while helping to bring vitality to our main streets. Our expectation is that once approved by Council, the first locations can be installed by the first week of July. The policy specifically provides that patios could be open as early as July 1st. We want business operators to be in a position to maximize opportunities in the summer months to the greatest possible extent. City staff will work closely with qualifying local restaurant and bar operators to establish options for cafe configurations within the right-of-way, meaning the streets and the sidewalks, while also temporarily pausing certain bylaw elements for the 2020 patio season in order to ensure that there is rapid installation of permitted cafes while maintaining public safety, that there is access to restaurant and bar services and facilities for those dining outdoors, and that accessibility requirements are met so that people can continue to use the sidewalk and move around these new or enhanced spaces. Permit and application fees will also be waived for approved cafes. At my urging, staff are working ahead of time now and ahead of the council vote when final approval will be given in order to make sure the program won't be delayed. I'm confident council will see the benefits of Cafe TO, as I have, and that today's local restaurant and bar operations can begin the process of registering for the proposed new program so that they can prepare and better understand requirements. So that application process is open as of today. Opening registration now and making available a new straightforward guidebook containing patio placement requirements for approved restaurant and bar operators will help us turn the key on this program sooner so that qualifying businesses can begin generating revenue from the new outdoor spaces sooner. The registration form and other details are now online at toronto.ca/cafeto. Finally, I convene a meeting once again today of the GTHA, Greater Toronto and Hamilton area mayors to discuss our financial crisis. We understand the Government of Ontario is working constructively, and it continues along the constructive work that has been done with the other premiers by Premier Ford. They're working to put a proposal forward to add to what the federal government has offered. We emphasize on behalf of all cities and towns that this can't come soon enough. The alternative is drastic cuts or unmanageable property tax increases, neither of which are consistent with a strong and fair recovery. We are counting on Prime Minister Trudeau and Premier Ford, both of whom have indicated their understanding of this problem and their willingness to help. They have to come to some kind of an understanding sooner than later, because we then need to move forward as cities and towns to show the kind of stability and strength necessary to produce a strong recovery. We know as of today, and Dr. Davila will make reference to this, that it will be a little while longer before Toronto and Peel will be able to move forward into stage 2. This regional approach taken by the province takes into account the fact that COVID-19 in more densely populated areas poses extra public health challenges for all of us. I know people, especially business owners, who remain closed or under restrictions, a lot of them told me this personally on the weekend, want this to be over now and to be able to move ahead with reopening. I heard that message loud and clear on the weekend, and I want things to be over with and for us to move back towards a more normal existence as soon as possible as well, for people and for business. We only want to go through this terrible experience once, however. We continue to focus on protecting health and saving lives and making sure that we don't have to lift restrictions only to then have to rush to impose them again weeks later if the virus flares up again. I am confident that we are making progress, and based on the advice of our Medical Officer of Health, stage 2 will come soon. But I want it to come when it is safe for everyone and for their families and for their staff members, based on professional medical advice that has guided us well throughout this pandemic and has saved many lives and stopped many people from getting sick. We will get through this. We have learned lessons from this tragedy, and that will help us to further protect our most vulnerable residents. And we have recognized the businesses that we find to be the backbone of our local economy, as they always have been, and we understand the need to get them back on track as soon as possible. Now, we just need to continue to follow the public health advice we've been given so that the number of COVID-19 cases in our community continues to drop and other positive indicators, and then we can safely push ahead with a successful reopening and sustained reopening of our economy. And on that note, I will ask Dr. Davila to provide her report for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 90 new COVID-19 infections in Toronto. To date, 11,098 people have recovered, an increase of 117 since yesterday. For more data on the status of COVID-19 cases in our city, I ask you to visit our website. As announced by the Premier last week, Toronto and communities across the Golden Horseshoe were not yet ready to move to Phase 2 of reopening. Today, the Premier announced that Toronto, Peel, and Windsor-Essex will continue to remain in Phase 1. I believe this is reasonable, given our current circumstances. And I know that our local businesses may also benefit from some time to get ready for safe reopening. But please remember, it is as a result of your efforts that we continue to make significant and steady progress. Your continued physical distancing and diligent hand washing are helping us to move forward, and I am hopeful that we will soon be able to join other Ontario communities in proceeding to safely reopen our city. I was pleased to launch our COVID-19 monitoring dashboard last week to help us track our progress towards our COVID-19 response objectives, which are to prevent loss of life, preserve the capacity of our healthcare system, and to minimize social, economic, and broader health impacts. While it is important for our numbers to decline, equally important is our progress against these objectives to assess our readiness to safely reopen. Today, our dashboard shows some further good news. Our overall status continues to remain at yellow, demonstrating continued progress. We have continued to achieve our goals and are staying below the threshold with both health system capacity and public health capacity. This means that we continue to protect our healthcare resources, and we are also making good progress to conduct timely follow-up on our positive COVID-19 cases and their close contacts. I'm encouraged to see that the number of COVID-19 cases reported to us daily continue to decline. We are getting closer to our goal of 14 days of decrease, but we are not quite there yet. While this indicator is progressing, we continue to keep a close eye on new hospitalizations and outbreaks, and I'm happy to report that these indicators are improving and continue to trend in the right direction, suggesting fewer severe infections and less disease activity amongst our most vulnerable. At this time, I cannot give you an exact date for us to move to the next stage of reopening. However, I encourage you not to focus on the calendar. Rather, I recommend that you visit our COVID-19 monitoring dashboard to see how we're progressing as a city, and I encourage you to continue to help us to reduce virus spread in our city. Each of us has a role to play in preventing the spread of COVID-19 so that we can keep moving forward to safely reopen our city. So first, while I encourage you to enjoy getting outside, I recommend that before you leave the house, make sure that you are prepared. This means packing the right items to take with you in the right way. This includes disinfecting wipes or alcohol-based hand sanitizer so you can keep your hands clean while you're on the go, and a clean cloth mask or face covering stored in a clean, resealable plastic bag. When you are out and about, try to avoid crowds and maximize your time outdoors or in open air spaces. If you are indoors in a public space where it is not possible to consistently maintain physical distance, please use a cloth mask and keep it on at all times to protect others from your germs. And while a face mask does not replace other public health measures like physical distancing and washing your hands frequently, it is another important tool that helps reduce virus spread. Please remember, when you get back home, wash your hands immediately and wash your cloth mask or face covering. Finally, I would ask that you continue to work at home if you can. Wash your hands frequently with soap and water, or use alcohol-based hand sanitizer if soap and water aren't available. Stay home if you're sick for any reason. And please, do get tested if you are showing any symptoms of COVID-19. If you can't drive yourself or walk to an assessment center, remember, if you need to take a taxi, wear a mask, and please tell the taxi driver before you get into the car that you have symptoms of an illness. These actions may seem simple, but they are powerful ways to keep us and our loved ones safe. Taken all together, these measures will reduce virus spread and continue protecting our healthcare system for those who need it most. These actions will also help us to continue building on our progress towards safely reopening our city. We all need to continue doing our part to keep moving forward. So please, continue to practice physical distancing, and where you can't, continue to take care of each other by wearing a cloth mask and doing your part to reduce virus spread. I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good afternoon. Today, I would like to provide you with a summary of EOC operations over the course of the COVID-19 pandemic in Toronto. As you know, our EOC has been operating at Level 3 since March 17th. Level 3 is our highest level of activation. We've been operating under declared emergency in Toronto since March the 23rd. Together, we built and continue to operate the largest and most complex incident management system in Toronto history. 148 city staff from 51 city divisions and agencies were assigned directly to the EOC at the height of operations. An additional 140 staff were directly connected to the EOC via their respective divisional operation centers in response to COVID-19. Within the EOC to date, we have managed an average of 171 incoming engagements per day. Over the course of COVID-19, the demand in the EOC peaked on April 2nd, where we managed 531 incoming engagements that day. Without any doubt, COVID-19 has significantly changed the way in which we work across the city, as we moved quickly to implement physical distancing provisions in our workplaces. Today, we conduct more than 2,000 video and teleconference meetings each day on a citywide basis. I would like to share just a few of the important services that have been provided in response to COVID-19. Shelter Support and Housing Administration opened 32 facilities and provided more than 1,400 people with physically distanced, safe space. More than 2,900 clients were moved to maintain effective physical distancing. More than $4 million in donations have been received to date. The PPE Task Force, which operates as a part of the EOC, has filled more than 1,250 PPE requests to date, and we've issued approximately 600,000 items of PPE to our frontline service workers. Finally, we are continuing to work hard to ensure the safe, efficient, and effective restart of city services. There are more than 230 individual services that have been identified and prioritized for restart, with more than 75 of these currently moving through the restart planning and preparation process. Our goal is to have each city service ready for restart as very quickly as possible, following provincial approval to restart these services as part of their phased restart approach. I am privileged to work alongside a team of caring and dedicated professionals who have and continue to give their all in response to COVID-19 in our city. In closing, I would like to thank everyone who continues to do their part to help us stop the spread of COVID-19. As always, I remind you that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. We'll go to questions. Just so reporters on the line know, we have staff here to answer questions, including Paul Raftis from Senior Services and Long-Term Care, Barbara Gray from Transportation Services, Carlton Grant from Municipal Licensing and Standards, and Marianne Bedard from Shelter Support and Housing. First question is to Matt Bingley from Global News. Matt, please go ahead.
Hi, good afternoon. I'm just wondering if you can shed some light on exactly how the decision not to move forward to stage 2 was made and how much actual input the city really put into that, and if there was sort of a cutoff time for looking at the current conditions and saying that we're not quite there yet.
Would you like me to take that? So thanks, Matt, for the question. It is a decision that is taken by, the province is responsible for their orders, and they are the lead agency as a result in terms of making the decision. So I can't speak to their particular criteria per se. However, from our perspective, there isn't a simple formula or a singular number that one can look at in order to make the decision on how to move forward safely in terms of reopening. That's why we put out our dashboard. It gives you a sense of a number of different indicators that need to be assessed, and we'd like to see progress on all of those aspects in order to understand and to assure ourselves, I should say, that we are in a good position to reopen. I do think that the current decision taken is reasonable, but certainly we look forward to joining the rest of the Ontario communities in progressing through the stages of reopening and getting our city back.
May I just add to that the following? There are no two people in Ontario, I am sure, that want to see us reopen faster in terms of getting people back to work and getting them back to a normal life than Premier Doug Ford and myself. We spoke at length about this on Saturday, and I think that while we recognize the fact, and I certainly learned even more from being out on the Danforth, for example, on Saturday afternoon, but I think we also recognize the fact that we have to be careful and prudent about this, as I believe they're being. I think that Dr. Davila's words in describing the decision today as reasonable in the circumstances is a very fair word. But make no mistake that we both want to see Toronto and Peel, for that matter, because we want to see the whole province, back on its feet with a return to as normal a life as possible, and in particular giving these businesses a chance to get going again, because we recognize, the desperate straits that they're in. But public health has to be the paramount consideration, and I thank the Premier for the fact that he and his government have been, and their medical officials have been willing to look at the challenges of different regions in the province, individually, so that we can make sure we don't make any mistakes. That's the really important thing, is to do this right.
Okay, thank you. And I'm wondering, Mayor Tory, when you were speaking with the Premier over the weekend, you mentioned the fact that they seem to be coming to the table with some sort of plan to match finances. Did he give any indication of maybe how much money might be attached to that? And to your mind, is it better than what the federal government has offered so far?
As you know, we had a meeting with the 10 GTA mayors that I convened together with the Minister of Finance for Ontario and the Minister of Municipal Affairs on Friday. And at that time, while they indicated there was some proposals being put together, they did not quantify them, nor did the Premier with me. And I simply underlined to him something I know he understands, which is that the federal offer is a modest first step, and that we now need the province to step up and really confirm his words and his efforts that he's been making on our behalf with some sort of an offer, and then I guess it'll be easier for all of us to judge the adequacy of those offers. But at the moment, it's hard for us to do that. But I think he also understands the gravity of these problems, which otherwise will cause us to have to make dramatic cuts to services and or huge tax increases, neither of which are going to be conducive with a robust recovery that has to be led by cities.
Okay, thank you. Next question is to Mark McAllister from City News. Go ahead, Mark.
Dr. Davila, I can appreciate that not everyone is hard crunching the numbers like you and your staff are. For those of us who are looking closely, I know you have continued to say you want that 2-week or 14-day sustained decrease in numbers before you say, yes, we're prepared. If you look at the last 14 days, there's been one slight uptick on June 1st, and that's it. It has been a decrease. So what is it exactly that we need to make that next step? If not today, then tomorrow or the next day.
So, Mark, that is indeed one number that you've referred to, the declining number in new case counts. And it's an important one, don't get me wrong. I think that's an important number to look at. But you'll note that the dashboard that we've put forward that helps us monitor our progress and helps us inform our decision around reopening contains much more than just one single figure. Because this is a complex situation and a complex undertaking that needs to be done carefully and needs to be done right, as you've just heard the mayor say. So I think that while we are looking at case counts, we want to make sure that we're seeing such things as improvements in hospitalizations and in outbreaks. Ensure that as our healthcare system is starting to move forward and take on some of the activities that had to go on pause earlier in the season, that they are able to maintain their capacity and ensure that healthcare services are going to be there for anyone who needs them, particularly if we experience any kind of resurgence in COVID cases. We are certainly watching the experiences of other jurisdictions very, very carefully. And for those who are watching what's happening in other jurisdictions, both here in North America and beyond, when there has been some reopening, you can expect, and one should expect, to see COVID-19 activity, because there continue to be a goodly proportion of people who are still susceptible. So it's a question of making sure that our systems are all ready to go so that we can do this in a safe and successful way, and so that we don't have to take a step backwards. I think these are the important considerations beyond focusing on any one figure or number.
Could I just make a comment on that as well? I can tell you from having talked to a lot of people and businesses over the weekend that the only thing they see as worse than waiting a few more days to reopen, which they'd rather not do. They're quite desperate in many cases to get open to save their businesses. The only thing they would see as worse is the idea that we might have to go through this again because we didn't do this right. And they made that very clear. As much as they want to be reopened as soon as possible, as I want to see happen, as the Premier wants to see happen, the threat or the prospect of going through this again is horrifying to them, as it is to me, and I'm sure to everybody that's had anything to do with this, including people out there who are not in business themselves.
Mayor Tory, perhaps as a follow-up on that thought, everyone seems to perhaps be wanting to read between the lines as we start to reopen slowly. There has been a number of announcements from yourself about looking forward to July with camps, et cetera. Now we're talking about patios, possibly first week of July. So week by week, we're slowly starting to see things reopen on a regional basis. Can we safely assume that perhaps one more week from now, we will hear the announcement we want to hear?
I'd be thrilled if that were the case, but I don't know because I'm not the Medical Officer of Health for Ontario or for Toronto, and I'm not the Premier. So I think, you know, you pointed out the fact that the numbers have been improving, and but there's more than one number to look at. And I just think, again, if people focus less on the calendar and more on those numbers and watch them, and they are moving in the right direction, and Dr. Davila indicated today there was lots of reason for encouragement, that we will get there, and hopefully sooner than some people might expect. I just think that what our job is to make sure that on things like the patio program and things like that, that we've done everything possible to help people get ready for the reopening and reminded people, average citizens, of some of their responsibilities, which will continue in physical distancing and face coverings and so on after the date, which I'm confident will come soon.
Okay, thank you. We go next to Kelly Grant from the Globe and Mail. Kelly, go ahead, please.
Hi, this is a question for Dr. Davila. As Mark mentioned, the case numbers have for the most part come down over the last week and a half, 2 weeks. Do you know why the case numbers have come down?
Well, I think there are a number of factors involved in that. Certainly, I would like to think that a significant part of that has to do with the measures that people have adopted. Good public health practice. Maintaining physical distancing, I think, is a key component of that. We've talked about hand washing or using alcohol-based hand sanitizer when hand washing facilities aren't available, staying home when you're sick, and getting tested if you have symptoms of COVID-19 and isolating appropriately and having your close contacts also quarantine until such time as we can figure out whether in fact a test is indeed positive or not. I think all of these measures taken together are certainly part of that. With nice weather, people are spending a little more time outdoors. We know that there are challenges around transmission within indoor settings, so that may play a role, but I think that this being a new virus, a relatively new virus only discovered in January, our understanding of it is not complete by any stretch of the imagination. So I think we have a number of different hypotheses, and we know that there are public health measures that have certainly contributed to the decrease in transmission, and we would ask that people continue to deploy those public health measures as they have served us well thus far, and I expect will continue to serve us well in the future.
Follow-up, Kelly?
No, I'm fine to pass it on, thanks.
Okay, thank you. All right, next we go to Jennifer Pagliaro from the Toronto Star. Jen, go ahead, please.
Thanks, Brad. I wanted to ask Mayor Tory about the report out on Housing Now. Staff have finally reported back on proposed rent control measures on buildings that are receiving city incentives. Just wanted to know, Mayor Tory, what your position is on the 2% above guideline increase that staff are recommending.
I support the staff's recommendation. They did a lot of work on this, and of course, one of the things they were trying to achieve is to make sure that we had robust competition from people who want to build these housing developments, including the substantial component of affordable housing, thousands of units, at the same time as providing a degree of protection to the tenants of those buildings once built that would take account of the fact that we are putting public land up here as part of the formula. And so I think what the staff came to was a fair recommendation that, as opposed to having no rent control, which I think would have been unacceptable, now puts a degree of rent control on these apartments going forward, and will provide a degree of protection to those tenants that reflects the public contribution of land, and at the same time make sure that we have lots of people competing to build these buildings from the nonprofit and private sector.
You know, there was talk as well at the committee meeting today about the work that staff put into this, but a document that spells out some of the costs is not publicly available. So for the average person looking at this, what they see is that the city is offering public land, which you know, we understand to be valuable, and some $300 million worth of city investment in these sites. And now they're being told that if you rent one of these market units, the city will also allow landlords to increase your rent above the guideline. And I think some people may find that challenging. And I just wonder what you would say to the public. This is your signature housing program.
You can never come to a perfect answer on these things, and let's remember that the reason for this entire issue being on the table is that the provincial government chose to remove rent controls from all new construction. So by having this degree of rent control, which may not be as low as some people would like, it's not as low as I would like to have it, but I have a responsibility to make sure we have people that want to step up and build these developments, and if they think they're not going to be able to get an adequate return, they just won't build them, and we won't have the additional rental housing and the affordable rental housing that we're seeking to get from Housing Now. And so I think what the staff have come to is a compromise that is one that will provide a degree of protection to those tenants, more so than if they were just under the provincial laws, which would provide no protection and just have unlimited amounts potentially for increases in rent, as measured against the other alternative, which is these buildings just don't get built. And so I think we need the housing. We're going to move forward with it. We're going to provide this degree of protection, and it's not perfect, but it is the best solution we could come up with to achieve all of those objectives.
Okay, thank you. Final question is to Haley Cooper from News Talk 1010. Haley, go ahead, please.
Thank you. My first question is for Mayor Tory, and it's regarding Cafe TO. So Executive Committee meets on June 22nd, and then the next council meeting is June 29th, and you expressed that you had hoped the first installations of expanded patios could be in by the first week of July. So I'm just wondering why a special council meeting wasn't called so we could really expedite this process.
Well, I think that if you take into account the fact that we have to go through the work of looking at the applications, which we're going to receive now, finalizing some of the design and other kinds of things, which are not unimportant when you're using the roadway space and going across sidewalks and things like that. I think you're going to find this program, from its conception to the opening of the first patios, will be done as quickly as anything in the history of city government. And we're wiping away all the red tape. And I hope that we can be in a position where more than one patio is licensed and open on Canada Day, assuming that the City Council approves it, say, on the first day of its meeting on the 29th. So I think we're doing well, and I think that at the moment the provincial order wouldn't even allow any of these patios to be in use in any event because it hasn't been lifted as yet. So I think we're doing well, and we're going to move as fast as we can, and I want as many of these patios to be applied for, which is why people should apply now, and to be in operation as close to July 1st as humanly possible, assuming provincial orders allow that to happen.
Thank you. And my follow-up is also for Mayor Tory. I'm sure you know many companies and businesses have had to hike prices and cut jobs in response to this economic crisis. I'm sure, being the former CEO of Rogers, you know the difficult decisions that have to be made in these sort of situations. So we wanted to know, when does the city decide that it needs to operate more like this than depending so heavily on the province for that funding? While running a municipality is probably very different in many ways, it's also very similar.
Well, let's remember the province, for example, can borrow money to finance its ongoing operations, as they're doing, and I'm not being critical of that. That's just the circumstances in which they operate. They have sources of income taxes, corporate taxes, and sales taxes we don't have. Those grow with the economy. So as the economy comes back and more people are working and spending money, they will benefit from that. We will not. We have only property taxes. So, you know, I think what really needs to be re-examined is a series of archaic, old-fashioned rules from 1867 about what cities, big cities like Toronto. This is one of the largest governments in the country. It's the fourth largest city in North America. And the notion that we should have to go and, quite frankly, ask for money because we don't have the means at our own disposal because of archaic rules that dictate that, it doesn't make any sense to me either. But I'm the mayor of Toronto, and I have to live with the tools for the moment that I've been given in the absence of some reforms. So we'll operate as we have done, in a business-like way. We will raise the revenues we have to raise through the property taxes. We will constrain our expenditures as best we can, but we have services to provide to people who need them now more than ever, and I just hope the other governments which do have other means at their disposal will come forward and help us, as well they should. We are key to a robust, sustained economic recovery in this country, all cities and towns across this country. We are the ones providing the services on the ground to those affected by the pandemic, and we need some help right now because we're constrained in what we can do for ourselves.
Okay, that concludes today's briefing. Thanks for joining us, everybody. We'll be back here on Wednesday, June 17th at 3:45 p.m.